Urticaria, also known as hives, welts, or nettle rash, is a raised, itchy rash that appears on the skin. The rash can be limited to one part of the body, or it can spread across large areas of the body. The condition can be accompanied by extreme heat and itching. It's an allergic reaction, and it can be triggered by specific foods, or by exposure to environmental allergens by contact or by inhalation. Where mainstream treatments are provided, these usually involve antihistamine creams or, in more severe cases, steroids. Ayurveda recognizes this type of problem as being caused by a Pitta imbalance. Excess Pitta manifests itself through irritation, inflammation, and infection, which can affect any system. It's vital to restore balance, primarily through adopting a Pitta pacifying diet, as inflammatory processes can ultimately affect the digestive tract, the liver, and the joints, amongst other systems, and the immune system can become severely compromised. The first step in treatment is to identify triggers, whether dietary or environmental. The diet is also carefully addressed to eliminate aggravating foods such as citrus, hot spices, tomatoes, red meats, eggs, seafoods, and sour or salty items. Sweet, bitter, cool, and liquid foods are encouraged. Ayurveda has some useful tools to lower the excessive fire of Pitta. The breathing exercises Sitali Pranayama and Sitkari Pranayama both help greatly in cooling and relaxing the body and the mind. There are some Ayurvedic equivalents to antihistamines. Many studies have shown turmeric to have remarkable anti-inflammatory properties. In fact, it contains over 24 anti-inflammatory compounds. A recent review of more than 700 studies concluded that turmeric appears to outperform many pharmaceuticals in its effects against chronic inflammatory conditions. At the YATAN Center, we will be able to help you identify your own triggers and supply you with an individualized regime to deal with urticaria. We can also provide individually prepared oils and creams. These are all chosen for their cooling properties. Coconut oil is one commonly used, but they vary greatly in their constituents, as what suits one person completely can create an allergic reaction in another. This means that formulations will need to be tested on small areas to begin with, last of all on the face. Urticaria symptoms can range from irritating to severely debilitating, but the problem is not just skin deep. Don't wait for it to go even deeper.
This is what's done on the